بسم الله الرحمن الرحيم. Today we will have case quiz number 90. Case data: 45 years old female complaining of progressive upper and lower extremity proximal weakness of a few weeks duration. 3 months prior to this condition, the patient was diagnosed as systemic lupus erythematosus and started on hydroxychloroquine, and low-dose prednisolone was added for her weakness for the last 3 weeks. Examination: severe proximal weakness, grade 2/5, in bilateral upper and lower extremities with retained strength in all other muscle groups. Erythematous rash on face, chest, and upper back, and no clinical evidence of involvement of other organs. Investigations showed creatinine kinase over 50,000 units per liter. So creatine kinase is shooting 50,000 units per liter. CT scan of the chest, abdomen, pelvis revealed no evidence of malignancy or interstitial lung disease. ANA was positive by immunofluorescence with a titer 1/80. Negative ENA and anti-double-stranded DNA, but positive anti-BL7 and anti-MI2. The rest of myocyte-specific and associated antibodies were negative, including anti-TIF1 beta, anti-MDA5, anti-NXP2, anti-SAE1, anti-JO1, anti-BL12, anti-EJ, and anti-OJ. Muscle biopsy of the left vastus lateralis was done. Hematoxylin, phenixylin, saffron stained sections show markedly abnormal muscle with numerous atrophic, necrotic, and regenerating fibers in a striking perifascicular distribution in figure 1 and figure 2. There was fragmentation of biremesial connective tissue with infiltration by histiocyte, as we see in figure 3, and alkaline phosphatase staining in the biremesium, as we see in figure 4. Immunohistochemistry for MHC class 1 showed upregulation of the sacrolemma of all fibers with slight perifascicular accentuation, which is seen in figure 5. Staining for C5b-9 membrane attack complex, or MAC, showed intense deposition of the sacrolemma of non-necrotic fibers in a predominantly perifascicular distribution, but not on capillaries, as we see in figure 6. Follow-up of this patient: prednisolone was continued together with methotrexate, and intravenous immunoglobulin was added. At follow-up 1 month later, she showed clinical improvement of proximal muscle strength to from 4- to 4 bilateral upper and lower extremities, and the CK creatine kinase decreased to only 1,169 units per liter. So, what is the diagnosis? And as usual, we will leave you for 6 days, and the answer will be online on next Thursday. Wassalamu alaikum wa rahmatullahi wa barakatuh.